Hi, Dr. Christopher Jonk is here. First of all, I want to introduce my buddy Rebel. Rebel's been helping me get through this COVID-19 crisis, so I have to give him a little intro. I want to talk about two things today. The first thing I want to talk about is what to use to clean your hands, what's best. And next, I want to talk about masks in public. So let's start by talking about hand hygiene. We've all talked about this before, but one question that comes up is, what's better? Alcohol-based hand gels versus soap and water. And I want to tell you my opinion is that soap and water is better. The reason being this: soap and water does some things that alcohol-based hand gels don't do. There are organisms, particularly spores from certain bacteria, that are not killed by alcohol-based hand gels, but are dealt with effectively by soap and water. The other thing about alcohol-based hand gels is they don't deal with grime and dirt and oils and other things that get on your hands. So they're not really cleansing agents. So once again, soap and water, 20 seconds, that's the way to go. There's been a lot of panic because there hasn't been a lot of hand gel available. Don't worry, soap and water is going to work out as well. In fact, I think it's really a superior product. Secondly, masks in public. So a lot of countries have adopted laws that make it such that all of their populace wears masks in public. So should we be doing this? Absolutely 100% yes, and I'll tell you why. We need a bridge until we get to a vaccine. All we can really do now to prevent the spread of the disease is physical distancing, good hand hygiene, and and reducing the spread of the virus from respiratory secretions, and that's where masks come in. We know that there's a lot of asymptomatic carriers who can spread this virus. This is why masks are particularly critical. You don't know when you're infected often, and you're at that time spreading the virus. So mask will help reduce the spread. Now, will the mask help reduce the risk of you getting the infection? Well, it depends. If you have an N95 mask, sure. But if you have a stockpile of those, they probably should be brought to the hospital where we need them. Most people don't have N95s. They have maybe some surgical masks or cloth masks. They protect to some extent, not to the same degree, but what they're really doing is reducing the spread of respiratory secretions and reducing the infectious rate of others. So once again, this is a life-saving measure. You won't know if you're infected often, and you won't know if you're infecting others. If you wear a mask, you will save lives if you are infected. So I recommend that everyone in public wear a mask. We shouldn't be in public a lot, of course, but if we are in public, we should be doing that. This is something that, once again, will save lives. So that's about it for today. These were two questions that came up I wanted to address. Until next time, I hope you all stay safe and take care, and send me some questions and I'll try to answer them over the next couple of days.